maternal mortality and infant mortality rate are the key indicator of the health state of any country. Countries all over the world are like working very hard to improve these stats. Like so far we have achieved good success in this aspect, but still a lot of work need to be done, especially if we see the disparity in the rural and urban stats as mentioned by Dr. Anurag. Like we see like rural stats are very worse as compared to the urban stats. If we summarize the challenges we discussed so far, like as mentioned by Dr. Anurag and Dr. Mahesh, major challenge in healthcare delivery, especially in the developing countries, are lack of resource. Like expert doctors are not available in the remote area and rural area basically. And second is the lack of awareness. Like most of the time, rural people are not aware what kind of facilities are available in the nearest healthcare center of government setup or private setup. And third is a compliance issue. Like discussed by Dr. Mahesh, that we need at least minimum 3 to 4 antenatal visits. And if we see that, like we compare the data of antenatal visit, usually ASHA workers register the pregnancy in the first visit. Like there is almost 95% registration of the pregnancy during the first visit. But if we say later on, second visit, third visit, and fourth visit, the percentage reduced drastically basically. Like ASHA worker help in first visit, but later on they are not like as much aware about the later. So we can try to reduce all these basically hurdle challenges in the healthcare delivery by using technology. In the like after COVID-19, technological adoption has increased because of the regulatory approvals. Medicine care or consultation remotely. Earlier, this was not allowed basically. Technological driven healthcare in the remote and rural area. For example, it's known fact that pregnancy outcome are not good basically. Like if we care is because of non-availability of the nearby hospital. So this gap can be reduced if healthcare workers like ASHA are empowered with the technology, and real-time alert system can be delivered. Like suppose ASHA worker registered a pregnancy in their application. So if there is next visit due for the pregnant woman, the ASHA worker as well as the mother also get a notification that your next visit is due on this date. Women are not aware that they need to visit the hospital. So if women or family member of the pregnant woman get an alert that you need to visit near hospital on this date, they may call ASHA worker or other healthcare worker that they can assist. And this can increase the company a lot, like for all the visits. Second thing, like we were discussing earlier, was that high risk pregnancies. High risk pregnancies usually lead to a lot of like death because of no detection of the high risk in early stage. If we see that usually high risk pregnancies are diagnosed in the second trimester, and sometimes it's already very delayed. So prevention of the causating factor is not possible when it's already have happened. And we have studied many studies that which trimester basically. Even some studies say that we can detect the high risk pregnancies even before the pregnancy. So if we can detect complication induced by the high risk pregnancies and avoid all kind of maternal death and infant death basically. The few risk factors these kind of parameters are not monitored by the pregnant woman because of lack of awareness that these are very important, vital for them. So if we can create awareness and provide instrument to like say weighing scale and simple BP apparatus. If we say BP apparatus is very cheap these days, but still most of the Indian families do not have BP apparatus at their home, especially in the rural area. So if we can create awareness, then they can self-monitor their BP and the weight at home itself. And that can itself lead to a lot of like improvement in the basically health state of the pregnant woman. Few risk factors like anemia. We were discussing about anemia earlier that stats say that almost 50% women are anemic. And during my like tenure as a medical officer in the rural area, whenever some woman came in our hospital, whether as a pregnant woman or some routine investigation or routine checkup or some other disease, if we say that you should get checked for the anemia, simple finger prick is required to diagnose a anemia basically. That finger prick does not need lot of blood or other complication. Even then, females are not, women or other people are not like ready to get even single prick. Almost 33 to 40% women are not ready to take the prick. So we thought that we should develop some kind of solution so that we do not need any kind of prick itself. So this solution should be non-invasive also. So we build a model invasive procedure like finger prick or anything else. And simply the simple procedure is very simple. First, patient need to take the image of their lower eyelid conjunctiva and send on WhatsApp. As we can see, WhatsApp penetration is very huge in society. So they can simply use the WhatsApp and take the picture of the conjunctiva and send to specific number. And that number will tell us whether the person is having anemia or not. And if this kind of simple application can tell that a patient is anemic or not, this can reduce the burden of anemia in society a lot basically. Like Dr. Mesh was telling that at least we need 180 days of folic acid and iron supplementation. But if female are not aware that they are anemic or not, they are usually not compliant. But if they are aware that they are anemic, the compliance of taking this folic acid and iron can be increased very much basically. And second thing we were discussing was that like awareness, like there are many kind of programs running in the India, especially for maternal healthcare and infant healthcare. But people are not aware of those programs many times. So WhatsApp-based chatbot can provide information about all these programs. Like any person can send message on WhatsApp, and then WhatsApp can give information like what kind of health facility or program or what kind of incentive you can get for your delivery or antenatal visit or postnatal visit. Suppose Indian government provides facility is not available in the government setup. They even sponsor the ultrasound cost if they have to done it from the private sector. But many times females are not aware of those facilities. So we can deliver that kind of information using the WhatsApp chat also. And other information we can deliver by WhatsApp chat is that, so suppose some pregnant women want to know like complications about the pregnancy or what kind of diet or nutrition they should take, like which kind of diet is having higher amount of folic acid or iron, or what kind of diet having proper basically what protein intake. So we can deliver all kind of this information on WhatsApp chat itself basically, and that can improve the not only the health stat of the woman but also and this kind of information can be delivered using the local language. Suppose someone do not know English and they cannot type English, but they can type Hindi or some regional language, suppose Punjabi or Tamil, Telugu. They can send message using that local language, and this chat can reply in same language they are aware of. And second use of this kind of facility is that suppose someone do not want to type anything, or suppose someone is specially able, like blind people, they can even send an audio message. They can simply speech and talk to the bot, and bot can reply to their speech-based questions. So this kind of facilities can reduce the burden on healthcare facilities. Like they do not need to visit for small queries to nearest center. Many kind of information can be delivered by the bot itself basically. And other things like monitoring weight. Suppose we were talking about that we should monitor the BP, we should monitor the weight, or we should monitor the calorie intake of the woman. This kind of monitoring is very challenging if we do not have some kind of proper tracking system. So at REAN Foundation, we developed a REAN Health application where anyone can track their vitals like weight, pulse, BP, and other information regularly. And also they can track the calorie intake. And these kind of stats can be visualized, like we can have an overall summary, like what is happening in last few months, what kind of vitals are improving or what kind of vitals are deteriorating. So we can get a complete summary of this information. And not only we can see that information in the application itself, we can share that information with any other healthcare provider like doctor or hospital. With single click, we can share all this information with the healthcare facilities. And like Dr. Anurag was talking about longitudinal healthcare monitoring and emergency healthcare. What I have observed during my tenure as a medical officer, I see that many times during the emergency, people do not have availability of some emergency contact number. They usually get panic when they need to call reports like ultrasound report, blood reports, so that we can share all this information on demand. Like even if we forget to bring the room, we can simply open our application and share this information with the hospital immediately. And are basically like we want to have some kind of holistic approach in basically mother and infant tracking, like immunization tracking. We can send a message to the mother that your child vaccination are due on this date basically. Thanks everyone.